I will just briefly one on Jingpynshai. The information we could gather from Manisha is that this particular nurse is a very sincere, quiet, dedicated, hardworking, selfless, who always had put the patients before anything else. She had joined service in around 2012. She was working in Mairang Civil Hospital, and then she was transferred to Ganesh Das Hospital in the year 2015. She had joined, and in the course of COVID last year, she was very active. She was put in the COVID ward, and in the month of December, when she had informed that she was carrying, she was taken out of the COVID ward and was put on duty in the general duty wing of the hospital, and she was in the female medical surgical ward. Now, we have got the number of nurses who had applied leave and were granted leave from December 2020 to May 2021. In 2020 December, there were 20, and 20 who had applied were granted leave. January 2021, 7 and 7 were granted leave. February 2021, 14 and 14 were granted leave. March 2021, 15 were granted leave. April 2021, 12 and 12 were granted leave. And in May 2021, 17 had applied and 17 were allowed to go on leave. Now, these type of leaves, different are earned leave on medical ground, earned leave as leave earned, maternity leave, study leave, commuted leave, privilege leave, and other leaves due to medical conditions. So the total number of nurses who were granted leave altogether from December 2020 till May 2021 is 85. The particular nurse who had expired, and once again we express our heartfelt condolences to the family. Was attending duties, and she did her last night duty on the 18th, 19th and 20th May 2021. When she had completed her duty on 21st May morning, she left, and as she had done night duty, she was allowed night off and was supposed to join on 23rd May 2021. However, on 23rd May morning, she had informed the sister in charge of the ward that she was not feeling well in the morning, and later subsequently in the evening of 23rd May 2021, she was admitted in the hospital, and she was done RAT was done, and the report was negative. However, the symptoms that she was presenting with was on the side of COVID-19 infection. RT-PCR also was done, and she was found to be positive. I will not go into the details of the disease proper, but treatment was provided accordingly in the hospital. But unfortunately and sadly, she passed away on 30th May 2021 at about 4:56 p.m. On this count, I think in the last session that we met, I have expressed and I have stated that in the ward where this particular nurse was working, there is no one who came out to be positive, neither the patients, nor the attendants, nor the people working in that room. So in that time, at that point of time, I said that maybe she had mingled anyway, maybe in the marketplace or anyway, and maybe she got that infection from the hospital outside to her home. There is no complaint as such from the family with regard to the leave application. Sister did not apply leave in writing to the authorities of Ganesh Das, who are supposed to process that leave. Perhaps seeing the condition of the other colleagues, seeing the condition in the hospital where there was a demand for manpower, she continued with her duty and perhaps must have also conveyed verbally, but that has not been substantiated by any of the supervisors in the Ganesh Das Hospital that she would like to take leave, maybe she was not feeling well. That has been told to us by the family members. And they have said that this is not a complaint, it is nothing, but we feel bad and we feel sad that so many things have come out in the media where we have already told only one friend that this was the situation and it came out in the social media. That added more to their anguish. So simpat kata-kata iki, ba kani kajingja kami ya social media kadang pin one show ya kani kajing here mensil, but kajing kerpa da kaliang kajungi na po health kabang ba nomor pandang kung kata kay ba jingkano ba na po hospital 11 that the hospital authorities, especially the matron, was cold-hearted. She never listened. That is completely wrong. And I want to say here, of course, no ki nong tray ki jongi po ki hospital affair. Manta kila tray nadu uncas nam hadu manta. They are working now whole year, now nearly 1.5 years. They are exhausted. And if people who don't know the facts will start blabbering something which is untrue and make it sound as if that it is true, that is the unkindest gut of all for the health workers. But niyong ni gani, namar teng-teng kajingya batay, daki kibriyo ki bamtip, ki persang ban batay ya ki badai hapo ka Jingpynshai yung ki hospital. They try to intimidate also the head of the institutions, trying to show them in poor light. This is unwanted and unwarranted. If our health workers now, right from the doctors down the line, if this continues and they throw up their arms in disgust and keeping in yaga jing bang so tanap but yaga jing no man same kani kanang wanra susu yaki jing bang so tanap hadin nago. So now I request all concerned to refrain making such charges without confirming first. If we have any shortcoming, if there is any lapses on our part, we will come out openly on that. There is nothing to hide. What is there to hide? There's nothing to hide. But if the charges are false, malicious, only to show our authorities in the hospital, our health workers in the hospital or in the PHCs or anywhere. Now we have the home management team, they're going to all the houses. We have the ASHAs, we have the Anganwadis. If you show them in poor light, it is only us who are going to suffer. We have said many times that to follow the protocols strictly. If we follow this, there will be definitely a climb down of the cases. Ndai fini ki babun ki perkhat ba uni corona dei ubashutha